So we are holding the international conference called Health for Humanity. It's the subtitle is a holistic approach to the pandemic.
Well, I've been a part of a team of people thinking together about the consequences of pandemic disease, the implications for the economy, the implications for our communities, and the potential responses in terms of public health and individual health preparedness and assurance.
I was asked by Bisong Guo, Dr. Guo, to help put the conference together. As it happened, by chance almost, I knew some people who were expert on epidemics and pandemics in the United States. Bisong knew a lot about who was expert in China, so we were trying to bring both sides together.
We really feel it's the time for all of us to, from each person, how can we evolve to become a self-mastering, and also to bring the ancient wisdom into the modern society. How can we do better? And then really to share their living and love, and at the same time create our kind of high technology to serve on a good purpose.
Well, Scotland has been a great host for this event, in part because it's an international conference and it's a terrific, beautiful place, but also an international opportunity to bring together people and to work together in a very suitable environment.
The conference we holding in Aviemore is we want to demonstrate how people can be gathered together, especially in the area which people have a very, very good sense about the earth and then protect nature, and also very warm on the community with each other and very natural.
Planning this conference has been, I would say, an adventure. We had such a motley group of people on the advising committee and the organizing committee, and very different opinions, yet at the end the whole thing came together beautifully.
It's been a great opportunity really to work across a number of boundaries, to work in East-West with our Chinese colleagues who are working on the same issues, and to work at the intersection of traditional public health mechanisms and a variety of other alternative approaches, complementary traditional Chinese medicine and other tools that may be helpful in preparedness and prevention for disease circumstances.
So the topic we will discuss crossed from the government response to the pandemic, and also the community resilient, and also the historical research about what human beings need to learn from the history, and also about the social enterprise, how the people can be engaging to help to working together, and then to managing our health and also social activities.
From my approach, I'm an economist, so I think about these problems in terms of their implications for the economy, the intersection of the health of our communities and the health of our economy, which is closely connected, and especially closely connected when we think about the potential for pandemic.
When a pandemic occurs, there's a huge amount of economic disruption. Figures have been thrown around of $30 billion lost because of SARS 10 years ago, the SARS outbreak in China. So a lot of things closed down, factories closed down, schools closed down. If things get worse, there's even deeper disruptions. The police might come to a halt. So a lot of things just close, airports close. The whole economy is disrupted.
There's a deeper dimension that has to do with our ability to effectively work together in communities to address these kinds of risks and considerations, and that has a lot to do with resilience, with thinking about what are the foundations of resilience personally and collectively that give us the ability to cope with extraordinary circumstances, however those may emerge? What are the foundations in our society and in our economy that get us through hard times?
The outcome we want to face or meet or come out is to really build up the collaboration in between the international level, with people really can work together and to link together, to be focused and get more efficiently to do the work if there's emergent situation happen, as well as to introduce the ancient wisdom about how to build a resilient community.
When pandemics strike, it's very local. It might be you that gets hit, or it might be people you know, or somebody down the street, and the authorities may be in no position to respond. Phone systems may be out, who knows what's going on. So very often the first responders are the people that are close to you. And then that works its way up to the community, and it works its way up to cities and on up to government response. So it's all these parts acting together.
This is a new and emerging field. There's a lot of work being done around resilience today, from both a health perspective, but also from a deeper perspective of understanding the elements in our economy that provide for resilience and what the foundational elements of that can be. So the conference has brought together some interesting thinking around that at many levels, from small-scale community organizers to experts working on social media, to those working in traditional medicine, to those working in the conventional public health and medicine domains.
What struck me about the conference was that there were so many different points of view. We had molecular biologists, we had health experts, we had Chinese traditional medicine experts. So what I'm hoping is the outcome of the conference is that all of these disparate groups start to talk to each other, and maybe out of that we'll get much better preparedness. Because for sure, it's like waiting for the next earthquake in California. For sure, something's going to come down the road in the next 5, 10, 20 years, or quite possibly even sooner. So we need to be prepared.
So I think the work that we are beginning here has a road ahead, and that road entails closer collaboration along the lines of building this mutual understanding of what provides for resilience. It does involve bringing together very different perspectives, but the hope is that it provides a greater access to very practical things that are the resources of our communities to deal with extraordinary situations.
And the conference benefit, we were thinking we leave to the history to really to tell in the future. But actually from right now, we can see people start already respond. The first said, is the conference the first time they feel like heart to heart connected with each other. Also, it's kind of symbolic, like Eastern meet West, and then to talk about our root and then the topic we really related each day, and also for our future.